Hi everybody. Welcome to this webinar. My name's Russell Cartwright. For those of you who don't know me, I set up this public health comms hub with the support of Can Digital, really as a place for us to come together to solve problems, to share learning, and to share good practice. If any of you've got any suggestions for topics for us to cover in future sessions, please do put them in chat. Similarly, if you've got any questions for any of our speakers today, also put those in chat, and we'll answer as many that we can during the session today. And if there's any that we don't get time to, we will follow up and answer them afterwards for you. We are recording today's session. And we will share the recording of the session with you all afterwards. And all of the previous sessions from these webinars are available for you to watch if there are ones that are of particular interest. Just to say a bit about myself. So for anyone who doesn't know me, I currently split my working time. So I am Assistant Director of Communications and Engagement at NHS South East London, ICB. And I've worked in NHS comms for the past 23 years. And in the last 5 years, I've become a bit of a specialist in behaviour change campaigns, having learned a lot about behavioural science and how it can be used to have real impact on public health. So I'm now also working as a consultant to train and support other in-house teams to incorporate behavioural science into their ways of working. So today I'm really excited about this session. We've got two brilliant speakers for you. We've got Edna, who is an NHS colleague from Shropshire, Telford and Wrekin, who will be telling you about an excellent campaign that she's led, which has achieved what I see as one of the real kind of holy grails for public health communications, and that's being able to evidence a positive impact on system pressures during winter. Edna, would you like to introduce yourself, please?
Hello, everyone. Nice to kind of see you all, because there's a lot of you now, so I can't see you all on the screen. But hi, as Russell has said, I'm Edna Bonepong. I'm the Director of Communications Engagement for NHS Shropshire, Telford and Wrekin, the Integrated Care System. My background is actually in public health, so that's where it's all started in terms of back in the day when we used to talk about social marketing, behaviour change. So that's very rooted in everything I do. I'm very much an insight-led marketeer and believe in evaluation, and I've worked in two of the biggest systems in the country, Greater Manchester and Cheshire and Merseyside, and at the moment I'm working in one of the smallest systems in the country, so it's great to have that breadth of experience.
Thank you, Edna. And so we're also joined by Shaoni, who is someone who I've personally learned a huge amount from in the past 5 years, having worked with her and her team at Ling Group on a number of award-winning campaigns. Shaoni is a global thought leader and speaker on the effective use of behavioural science, data, misinformation and measurement and evaluation in PR and comms. Shaoni, could you introduce yourself, please?
Yeah, hi, and nice to see lots of familiar faces. Hi, everyone. Lovely to be here with you. I'm a CEO and founder of Lin, and I'm also a fellow of the CIPR and the PRCA. And at the CIPR, I'm vice chair of the Behavioural Insights Interest Group. And as Russell said, we worked collaboratively for about 5 years across multiple public health challenges, and at Lin we also set up the UK's first anti-misinformation service called the Misinformation Cell. So we are at that sort of cutting edge and intersection of human behavioral challenges through the lens of disinformation and now also generative AI. So lovely to be here today.
Thanks, Shaoni. And so these sessions, so this hub and these sessions, these webinar sessions, are only possible with the great support that I get from Can Digital. So I'd also like to ask John Paul to introduce yourself.
That's very kind of you, Russell. Hello, yes, I'm John Paul from Can. We're a public sector media agency, and we focus on reducing cost per outcomes, or giving you more outcomes for whatever budget you have.
Right, thank you, John Paul. So before we hear from Edna and Shoni, I'd just like to set the scene a little bit. And I think in PR and communications, most of us recognise the value and importance of good evaluation and good measurement, but we're all busy, we're all under pressure, and we often move from one project onto the next thing, or sometimes we're a bit scared actually, or a bit anxious about doing good evaluation, because we don't get budgets very often, we don't get access to money very often, and when we do, we might be a bit worried that we could show that money we had didn't quite have the impact we wanted. But that's all the more reason, I think, to do it. But I think so many of us don't do evaluation and metrics as well as we want to, and often these do just focus on what many people call kind of vanity metrics. I love this quote that's on the screen now from Richard Bagnall, who recently won a Sabre Award for his career, which has been devoted to measurement and evaluation. Richard is a former chair of AMEC, which is the comms measurement and evaluation body, a global body for that. And I think the quote highlights the need to move on from using vanity metrics like volume of your outputs or reach, and to focus on real outcomes and the actions that people take in response to your communications. Otherwise, we could just look, as Richard calls us, like busy fools. So yeah, I'd like to, I'm going to stop sharing these now, and I'd like to ask Edna to present to us the Think Which Service campaign.
Thanks, Russell. So I am just bringing up my slides. Hopefully they'll pop up at any time. When you can see them, just give me thumbs up. I like it. Okay. So thank you very much for that introduction, Russell. I think that lines me up quite nicely. And I think, as you've already said, one of the most important things, or most difficult things, we face as communicators is how to prove the value of our work. So a lot of what we do is very subjective, and we know that, and it's quite hard to measure, especially the stuff that we do around corporate communications. However, in my experience, we can measure more than sometimes we realise, and comms is not just about a corporate. It's not something we just do for a corporate purpose. It can actually be used to achieve some of the organisation's strategic objectives. So very often, as communication professionals, we jump straight into measuring the inputs or outputs rather than the results, which in my view is much more important, and I'll talk about that in a moment. In the communications industry, we've fallen into this trap of thinking the bigger the better when it comes to results. And I saw this phrase once, which I quite liked and I've stolen, which is big numbers have become the battle shield for communications measurements. So for instance, if we're talking about PR campaigns, we quite often measure media coverage, the extent, the tone and the reach and the equivalent advertising reach. However, we kind of know that isn't the be all and end all, don't we? Because if we're just churning out media releases and gaining publicity, it doesn't necessarily mean your target audience has responded or will respond positively, or it has increased their awareness, or it's changed their behaviour. What we're merely doing is measuring inputs, which is distributing the information to the news outlets, and outputs, which essentially is the publicity. So quite often it's just about whether the journalist or the newspaper actually likes what we're saying, and it gives us very little idea about the impact it's had on our audience. And that's the same with social media. In social media, we get into this trap of just looking at measuring the likes, the visits, to how many people have engaged with our posts, also our websites, how many people have visited our website. Now, what I'm not saying is that we shouldn't be looking at all of that, because they are great indicators that tell us, give us some insight into how well we're doing and the numbers. And actually, quite often, in some ways, they're the easiest things, especially if you haven't invested beforehand to do any tracking, evaluation, or we don't always have the time, do we, to put into evaluation. So these are sometimes the quick wins that we can lean on to give us some indication of whether our comms has been successful. But what we should be doing as marketing and communication professionals is looking at ensuring that in some way or another our comms or our marketing has had some tangible results or tangible behaviour change. And I think if you can put planning in at the very early stages, you can calculate in a more meaningful way how your communications, your marketing efforts have landed. So that for me is the key thing as an insight-led marketeer, as someone who's got a background in behaviour change and social marketing. My aim with most of the things that I do is around changing behaviour. Not always, but a lot of the time. So as I've said about, we need to measure things that we believe proves the real business or organisational value. So I think, oh, my helpful assistant, I think, is just popping up a poll right now. So one of the things I would say, if you are writing a proposal or trying to help your leaders to understand the value of communications, I encourage you to do your homework first. You need to know exactly what is most important to your organisation, and you need to focus on those things for your organisation. So my question is, do you know what outcomes your board or your senior leaders are looking for? What's the things in your organisation that your senior leaders and your executives value the most? Now, I did this in NHS Communicates just to get a flavour for what people are saying. So it'd be interesting to know what everyone thinks. Now, there's about 80 odd people on the call, so we'll give it a minute or so to let people think about it. Now, I know that, and we've only allowed people to vote once. So I know that many of us will say, well, it is this and it is that and it is this. What I want people to think about, if you were to put a gun to your leadership's head and said, what is the most important thing to you with regards to communications, etc., and engagement, what is top of mind, the most important thing? So let's have a look. Oh, it's shifting quite a lot here. So we've had about 40 odd responses, and people are saying the reputation of the organisation, that always comes up. Okay, people are saying robust patient and public engagement to improve services. That's important, because I'm a real favour of that. Okay, so we've got a bit of a, oh, it's still moving. I think, and this was similar in NHS Communicates, I think what's coming out, oh, someone said it changes month to month. So I think a key thing that's come out here is website, social media activity, etc. is not top of mind. And I would have imagined most executives and most boards that isn't. But actually what people are saying is the organisation's reputation, the exec's reputation seems to have come out quite highly, and engagement to improve services. So I think that sounds about right. And then you've got some others here, the stakeholder engagement has come up. And okay, does that, I think that feels about right. If you ask most communication specialists, that's what they would say, the things that their executive teams focus on. Okay, now again, Russell lined this up for me. I'm going to talk you through 5 steps, and I could probably fit this. I could have done this in 7 steps actually, but 5 feels like a slightly neater number. But 5 steps for effective communication and delivery measurements. And these are kind of some of the things that I think about when I am planning a campaign. And I'm going to give you a bit of a humble brag now. I've won a number of prestigious awards for behaviour change campaigns, and it's mainly because of the strength. Thank you, someone's clapping for me there. And it's usually mainly on the strength of my outcomes and my evaluation, because I think that we can all have great ideas, we can all deliver some really innovative, really lovely looking campaigns, but in the end of it, it's the and so what has changed, what's the impact. So the first thing that I always look at when I am looking at any type of campaign, communication, activity, marketing, is identify the activity that will deliver your organisation's objectives and strategic aims. The second thing is about insight and data. I always need to understand, who am I trying to target? What do they look like? What are their views, opinions? How does that differ from one area to another? So profiling, segmenting. So that's the second thing that I always do. I always need to understand my audience, and you can apply that even if you're doing some kind of work around stakeholder relations. So when I'm working with our MPs or politicians, I do my homework first. I need to understand what are the things that are the things that they're campaigning against. What is the sweet spot for them? What are the things that are of major interest? If you know people and know where their sweet spots are, but also know the things that they don't like, it can make it much easier when you're having conversations or trying to communicate with them. The second thing, goes without saying, is once you've got all of your insight, once you have a good understanding of the people you're trying to target, develop your strategy and implement using the most appropriate messages and the most appropriate tone and voice and the most appropriate methods and channels for the target audience. So what I would say again, and I always say this, is one size doesn't fit all. If you go out with a campaign that is just very, very generic and you treat your audience like a homogenous group of people, you won't get the results you need. You need to ensure that actually you're delivering the right thing at the right time to the right people. Now, number 4, you can do before number 3 if you like, or after you know your audience. But the other thing that's really important before or whilst you're thinking about delivering your campaign is building a measurement framework that covers your output. So you have a good understanding of reach. So we're going to know how many people we've reached and who we've reached. Your outtakes, which is around how do we know how people are responding and reacting to this piece of comms or this activity that we've delivered. And then the last thing is about your outcomes. What is the impact that you have had? Now, for me, it's really important to actually look at all of those 3 things. And what I find is quite often people only look at the outputs. So what's the reach, or maybe they've only looked at the outtakes. But your framework should look at all 3 of those things if you really want to look to demonstrate impact. And lastly, you connect the outputs, the outtakes, the outcomes and impacts to really see the difference that you've made and if your campaign or your activity has been successful. So I'm just going to whiz through now this case study, which Russell talked about, a campaign that has recently won a PRCA award and a NHS Communicates award for a campaign I delivered in NHS Shropshire, Telford and Wrekin, or our integrated care system around our winter pressures, which was called Think Which Service. So first thing, aligning our organisational strategic aims. So anyone that works in the NHS or even in local authorities does not need me to talk about this too much. We know that last winter and the winter before that, we have seen some of our toughest winters. Significant challenges across the whole of the health and care system, rising COVID numbers, lack of capacity in community, urgent emergency care, GP services about to fall over because of the pressure. We looked at our data, our A&E data, and what we could see was about half of the people that were accessing our A&E could have been treated elsewhere. They could have been treated in a minor injury unit, or they could have been treated in an urgent treatment centre, or could have been treated in a pharmacy. So what we were thinking about was, okay, so we've got some high demand, but actually all the demand is being seen in 1 or 2 places. Actually, how can we change that? And as we all know, anyone who works in the acute sector or even in ICBs, that unprecedented pressure was resulting in ambulance handover delays and poor patient outcomes. This is another brag, but this is not a positive one. Our system has some of the worst ambulance handover delays in the country, and our system is one of the worst in terms of our urgent and emergency care performance. So this campaign was vital to ensuring our services didn't fall over. So we needed to deliver a campaign which empowered our population to stay well over winter, but also use services more appropriately. we wanted to reduce the number of ambulance handover delays, and importantly, we wanted to improve patient care and potentially save lives. So, understanding the audience, and as you can appreciate, I'm whizzing through this, but if anyone wants all of the insight because there was so much intelligence that we gathered before we even went into the campaign, I can share that with people. But the first thing for us was we knew that pharmacy was an underused resource, so we looked at we got a load of insight from pharmacy, trying to understand the role of pharmacists, what were the barriers for people using the pharmacy services, and actually what was the issues between GPs and pharmacists, if there was any professional snobbery there, how could we break down some of those barriers. So we did, first of all, we started with our pharmacy, did some insight into pharmacy use. We then did an online survey to get a bit of to do some insight, to gain a better understanding of awareness around urgent and emergency services and how people choose to access services. And lastly, as I say, we really interrogated our hospital data. We really wanted to understand the most common reasons why people were accessing A&E, and we really wanted to understand who were those people that were accessing A&E who did not necessarily need to be there. And that gave us a really rich picture in terms of, from a postcode and profiling, from a population profiling point of view, but also from, we know that soft tissue injuries are one that people come to A&E for a lot, when actually you can see that person could be seen in MIUs. So that helped us build our strategy. So we had 4 pillars, essentially. We wanted to drive awareness of pharmacy, get more people to be seen in pharmacy, and anyone that's, again, working in our ICBs will know that since Pharmacy First has been introduced, we've started incorporating a pharmacy first message, which is that basically now your pharmacy can deliver so much more than they did before. We wanted to drive awareness of how to use alternatives to A&E, like NHS 111 online and minor injury units, and highlight people's responsibility for taking and their role to play this winter. We wanted to ensure that people were getting vaccinated, both from a COVID point of view and both for their flu vaccination, to reduce the spread of respiratory disease. And lastly, really importantly, we wanted people to drive awareness about looking after yourselves, but looking after your neighbours, your friends, your families, and your mental health. So those were our 4 pillars. Our strategy was to get people to build confidence in the system, so people had a lack of trust in NHS 111. They all wanted to see their GP, they all wanted to go to A&E, but actually what we needed people to understand was build trust in pharmacy, build trust in NHS 111. We wanted to educate people on how to use the system differently. Again, that was part of the building trust piece. Once we build that trust, so people knew what they were, then educate people how you can use it, and why you should use it. And then the final stage was about showcasing success. So when we've told people about what they can use and why they could use it, we've then showcased, well, actually, if you use it, you'll actually get faster care, you'll get the most appropriate care in a lot of ways, and actually you are also taking pressure off the system. So people that really need A&E support, or people that really have complex cases and needs to go to GP, can be seen more quickly. We incorporated a full mix of different medias. Again, this was based on our intelligence, so we knew what medias, what channels people from the various groups that we were targeting were most likely to resonate with. And we did some really innovative stuff. So we worked with Dr. Hilary Jones and Dr. Ranj, who were both sort of famous doctors, to deliver some podcasts that were just something different, because we knew that we saw that it was a growing trend in men listening to podcasts in particular. We did digital radio. We developed a whole host of videos, we did bus advertising, etc. And we did a door drop, but we did a really targeted door drop to areas that we knew were using A&E more inappropriately. So loads of stuff, but all very targeted. And also, because we're in a very rural area, we use CTV, which is basically 4OD advertising, YouTube advertising, that type of thing, to get into the homes of people that may not be out and about as much. Very quickly, I said you had to do 3 things: build your outputs, outtakes, and outcomes. So your outputs, hits to website, social media engagement, your digital radio reach, media reach, all of that sort of stuff that we always measure. We did some post-campaign research to look at awareness, sentiment, has it changed knowledge, attitudes, understanding. So that was how we knew how people are responding. But our outcomes were, we were looking for a reduction in A&E activity. We wanted to see whether there has been an increase in minor injury unit activity. We wanted to see if there was an increase in NHS 111 online activity, and if there, very importantly, was a reduction in lost ambulance hours. And these are our results. So outputs, I started with the outputs because remember what I said, the big numbers, those were some of the big numbers. So we got in our campaign, during the campaign, great number of impressions for over social media and reach, a good number of hits to our website, to our campaign landing page. We're a small system, so there's only 500,000 people in our system. So actually those numbers, just in terms of reach, are good. Our podcast downloads in just 1 month, almost 700. Our outtakes, our post-campaign research, 31% of respondents were aware of our campaign. 92% of the respondents felt that it had important messages. 82% said that it reminded them of what to do. So we knew that it had landed well with people seeing it, but also people saying that it was important and the messages landed well with them. Our outcomes, though, this was the important thing. So we could see that we had a 7% reduction in A&E attendances, 13% increase in people and activity at minor injury units, 62% increase in people accessing NHS 111 online, and importantly, 65% decrease in lost ambulance hours, which equated to around £5 million. Now, I've got a few slides to just, have I got a few more minutes, Russell? Yep. Right. So I'm just going, because I'm just going to take a bit of a deep dive into some of these activity figures. So again, I can share these slides afterwards, but I just want to give people a bit of an overview of, so when people say, oh, how did you get to those figures? Well, here they are, our A&E activity figures, and you can see here what we could see across both our acute hospitals, that we know that attendance was lower the year before. However, it was lower than the year before, but however, 3 of the biggest drops that we saw was in January, February and March, whilst our campaign was running. And we didn't see a similar trend in the previous years, but the important thing about this, when we looked at our A&E activity data, was the drop in attendance was largely driven by those arriving by their own transportation. So this means that people were making different choices about accessing A&E or not. Similar picture again. There's a lot of slides on. A lot of data on this. Similar situation with our minor injury units. We could see that in January, February, March, April, we saw an increase in people accessing our minor injury units. And what we saw was slightly more like the people that were coming were slightly more likely to attend based on their own decision, rather than a referral from a health professional or from NHS 111. So again, this showed that people were more aware about minor injury units and more likely to come and access them. Our NHS 111 online activity data, again, similar pattern. We saw that in December, in our area, we consistently outperformed England for NHS 111 online traffic. And it was consistently higher for the last 4 months where we were doing our campaign. So that showed us again that our campaign, because there was no other campaign, there was no other national campaign, we knew that our campaign was driving more traffic to NHS 111. And lastly, this is the bit for us that, given, as I said, we were one of the worst in the country for ambulance handover delays. You can see here again between our campaign period that we saw a considerable reduction in lost ambulance hours during our campaign periods. And what I worked with the West Midlands Ambulance Service to give a bit of an estimate of what that meant in pounds and pence. And what that equated to roughly is a reduction in about £5 million worth of lost ambulance hours. So our campaign cost us in the region of around £75,000. Well, when you think about the cost of £75,000 versus a saving of £5 million, I mean, that's the sort of figures that actually you can't argue with. And that's why the following year, I got even more money to do a similar campaign, because you couldn't argue with the results. So my last point, as I've said before, proving the value of communications isn't always easy, because actually there are some things that we do because we know we have to do them. But big numbers, that's what we say has the battle shield for comms measurement, isn't the be all and end all. So again, I've seen this phrase that I really liked, and it talks about putting down your defensive battle shield and picking up your strategic spear. Let's be more strategic with our communication. Let's really prove the value and impact of our communications. And actually, that will mean that going forward, you will always be able to get resource and funding for your communication, because it will show how it is impacting on organisational objectives. It will be liberating for you, I'm sure. Thank you very much. That's me. My contact details, my LinkedIn details are there. If you want to contact me and reach out, I'm quite happy to speak to anyone who wants to know a little bit more about the campaign.
Brilliant. Thanks so much, Edna. We will come to questions shortly. So there is a few in chat already, but please do put any more that you've got for Edna in chat. Amazing campaign, and I love the strategic spear analogy. Edna, I want to go out and buy one for myself now. Can I bring Shoni in to talk about how Lynn used measurement and evaluation, please?
Yeah, sure. I'm going to share my screen. Give me a minute. But there's something going on with my camera. Not quite sure. So hopefully I'll switch on as we carry on. Thank you, Anna. That was obviously great and great primer to what we're going to discuss today. Picking up on something Russell said earlier about budgets. You don't need budgets to evaluate, especially in today's day and age. Access to multiple data points, and now, of course, generative AI. I think we're in this amazing space as communicators to quite tangibly prove our value to our organizations and at pace. So I just want to touch on the importance. I mean, I'm sure we all agree measurement is important and is a cornerstone of effective communications, and it should be seen as an intrinsic element of all communications and campaigns planning. Because if we don't measure it, we won't know what works, what doesn't, and why. And whilst that seems like something that we as an industry always champion, sadly, the reality in terms of adoption and also proper adoption is quite low. And I say this as someone who judges industry awards all the time. It's not just evaluation, though, is it? Because it's also about research and planning, because that should go hand in hand with measurement. They're the best ways to demonstrate our value and effectiveness to our businesses and organizations. I'll hang on, I'm trying to work this. There we go. This is very strange. I don't use Teams for presenting, so this is catching me out. And the reason I think we are necessarily not as equipped in demonstrating our value in measurement and evaluation is we don't often spend the time that we should in setting the right objectives to our campaigns. And therefore, when we measure at the end of a campaign, that measurement may not demonstrate that value effectively because those objectives were not set at the start. And if we have people in the house that consistently use C-SMART objectives, well done. And I hope you will go and share that with everyone else in the communications industry so we get more people to do this. But in order to measure, we must set clear objectives from the outset. We must know what we are trying to achieve clearly, so we know what we're measuring, and therefore we're able to communicate our value. And it's not good enough, thanks Alex Aiken, to be smart. We need to be C-SMART. And that means we need to have objectives that are challenging as well as specific, measurable, attainable, relevant, and time-bound. This is really important. I can't stress this enough. Unless we know what our targets are at the start of a campaign, it's so hard to measure to see if we achieve them. And therefore, it becomes harder to communicate our value back to leadership. Yet I understand, and I say this as someone who came from my entire background before Lynn was public sector, and I understand we're often dealing in organizations which don't set smart objectives themselves for programs and policies. So how do we as communicators create smart communications objectives in these situations? And there are ways around it. For the purpose of evaluation, it is important that objectives contain these three elements: baseline, change, and explanation. So baseline is your numerical prediction of what will happen if no communications activity takes place. So if you look at population level interventions, say pensions, some people will take out a pension with or without communications activity. And a baseline should be set using the most recent data available. When setting baselines, I must stress it is really important to consider any predictable movements which might happen without communications interventions. And data sources for setting baselines could include a whole range of data sources, such as you could use internal consultation information, publicly available data, commission research like Edna talks about, or proxy data as well, if you don't have specific data to hand. Change is your numerical forecast of the difference that communications activity or campaigns activity will make. So if baseline is what happens if no activity takes place, change is the numerical forecast of what difference a campaign will make. So you could be looking at improving levels of service users from X to Y, or an increase of X%. And changes should be for a defined period of time. And then finally, explanation or justification. We as communicators should use an evidence base as justification for the level of change that is being targeted. And typically your justification could be in line with previous campaigns you've run. So Edna's obviously got great data. So when she does this campaign again, she has justification in terms of the smart objectives that she would set for the next iteration of such work. Making assumptions, though, is acceptable because sometimes we might not have the information up to hand to be able to set specific data-driven objectives or justifications. It is okay to make assumptions, but you need to be very clear where these are assumptions and where they are data-driven. So these should be clearly identified and justified. And talking of behavior change campaigns, Lynn, we're powered by behavioral science. This is our bread and butter. It is very important to signal if a behavior is being targeted as a start of a behavior, or if you're maintaining an existing behavior. And also, if you are running a behavior change campaign, please specify the behavior you're trying to change or create or start. Often we see a lot of awareness campaigns being badged as behavior change. So having that specificity in target behavior identification is critical. So what does that mean in practice? So I'll just take you through a couple of steps in what we do at Lynn. And a lot of this has been informed from my time in public sector comms. So research is fundamental. We use formative and summative research to better understand populations so we can drive the right outcomes. So when we look at a problem and vaccinations, and I'll have a case study on vaccinations, a piece of work that Russell and I worked on together. When we look at vaccinations, for example, we always undertake local primary research, and our research is conducted in-house to understand the motivations, the barriers, the norms, the influences of that population before we design any intervention recommendations. And that could be either communications interventions, it could be design interventions, it could be policy interventions. We need to understand why we should be motivating or influencing or persuading our audiences to undertake that behavior. And we need to understand what the barriers are. Do they know how they can access vaccinations? Can they access their vaccination clinic? Can they access the vaccination clinic at the time we want them to access said clinic? Can they access the online booking page? And we know in public health, there's a lot of challenge around the systems that we work in, which creates a lot of friction in that consumer journey or the user journey that we try and promote. And also what are the social and cultural norms when it comes to vaccinations? So a lot of the issues that we work with, especially in public health, but even at the intersection of health and climate change, can be quite complex. So it is really important to have quality research, and certainly an important fundamental part of the behavioral science approach, underpinning intervention recommendations, that is development and strategies before we get to creative ideas and execution. Traditionally, mass behavior change comms has been viewed through the lens of awareness raising. So you have an existing behavior, you raise awareness, and by that we mean we let audiences know there's a new behavior via messaging. And of course, as we know, audiences then adopt the new behavior. Now, we know that's not the case. So instead, what we focus on at Lane is to understand what is the problem that we're trying to solve. Who are the people we're trying to speak to? What are the behaviors we're trying to create, maintain, or influence? And what are the barriers to those behaviors to the lens, not just of informational barriers, but also structural barriers, cognitive barriers, and social barriers. And this helps us diagnose the problem correctly in order to identify the right intervention solutions to motivate change. Experiments, really, really important. Experimental testing is a big part, a key part of a behavioral science approach. And we're the only UK agency that has embedded experimentation across all campaigns. So what is experimentation? This means that we test our interventions, so our creatives, our content, our calls to action with our target populations via randomized trials, both in field settings and in control lab settings. So this is going a step beyond A/B testing, where we are looking at controls and treatments to understand from a statistical perspective what is resonating on the ground with target populations. And by doing this, we secure data insights and also confidence that our hypotheses, our solutions will work in the wild, so to speak. In behavioral science, there's a huge replication crisis. I'm sure you may know this already. What works today may not work tomorrow. What works in one context may not work in another. So it is really critical to adopt experimentation to test the effectiveness of solutions before activating ideas. And evaluation, of course. This is critical to demonstrate the effectiveness, as I say, of our approach to business and organizational goals. So we always set baselines at the start of all projects, and we also undertake real-time monitoring, which I was very pleased to see has been highlighted in the new GCS evaluation cycle. So that's brilliant. This helps ensure that all campaigns remain optimized. It helps us undertake an iterative learning approach during the lifetime of a campaign, and it helps us to remain fully flexed to be able to change tactic at short notice. So when I talk about evaluation, we are not just looking at active monitoring, which is the impact of strategy and executions via summative research, for example, pulse surveys, and then the prevalence of new behavior, which in our case, and in your case in public health, would be monitored systematically in most cases. We are also monitoring the change process so we can attribute communications impact on real-world behavior change. Enough theory. Here's a little case study. This is Don't Miss Your Vaccine. I hope you've heard of it. I hope some of you have used some of the assets that we created because it was taken up by NHSC and distributed across England. So don't need to remind anyone about COVID-19. This is taking us back to July 2021 when restrictions were going to be relaxed in England. And the hypothesis at the time was that when the priority program moved into mass vaccination, we would see high take-up. But we know that did not happen, and we saw high levels of vaccine hesitancy in younger cohorts. And in Southeast London, the data indicated there was high levels of hesitancy and lower levels of take-up amongst young people, especially among some BAME communities. So we had this deadline of Freedom Day, as we called it. And our client, which was Russell in our Healthier Southeast London, ICS knew that they were in a race to reach and persuade as many young people to access the vaccine. So we turned this campaign around in a week. That was a very stressful week. And the reason we were able to do so was because we'd worked in that patch before. And we also had a lot of primary insights that we were gathering across England into that specific issue and into that specific target audience. So we were able to bring those together quite quickly. We felt, well, our research found that, and some of this will be familiar, young people felt scapegoated. They did not feel recognized for the sacrifices that they were making to protect others in the community. They were also anchored to believing that they were not at risk at the start of the pandemic. But of course, the mutations changed this. It became transmissible. Can't speak anymore. It's Friday. Transmissible in young people. But this wasn't communicated necessarily clearly enough. And so young people did not quite understand why they needed the vaccine with such urgency now. And we also found that a lot of young people displayed a level of stoicism and sacrifice. So in our focus groups, a lot of young people were telling us that I will give up my spot to allow someone who is more vulnerable to access the vaccine. Looking at the behavioral barriers, we used the behavior change wheel and COM-B to diagnose this particular problem. And we found several specific barriers. We found optimism bias played a huge role. So we know that this happens quite frequently when you're looking at risk science, when you're looking at people pushing through their risk thresholds. And you see this in any health emergency where you move from described risk to experienced risk. But we had individuals who hadn't had COVID despite displaying non-protective behaviors, and they felt that they did not need the vaccine. And there was a lot of status quo bias or inertia, which is our preference to be passive and defer our decision making. And we also found an element of present bias or hyperbolic discounting, which is choosing short-term gains over long-term gains, or smaller sooner rewards to larger later rewards. All of this manifested in these groups pushing their risk thresholds and demonstrating high levels of hesitancy, a lack of urgency in accessing the vaccine. This diagnosis was crucial because it helped us create an easier path to target behaviors, including the key recommendation, which was to deliver the campaign through the lens of freedom and personal benefit. Just a brief on audience segmentation, and here we have it, the campaign. So we harness the power of personal benefits, of course, alongside health benefits, to incentivize and motivate young people to access the vaccine quickly. So at the time of this campaign, the UK's prevalent messaging was focused on protecting yourself and others. And we segued into a different frame, which was this key behavioral insight that we'd identified locally, which was to do it for yourself. Do it for, frankly, the selfish reasons. Do it for going to the pub, do it for going on holiday, do it for going on that first date. Just do it for yourself. So don't miss your vaccine as a creative brand identity, strategically connected vaccination with personal benefit. It rose above the noise of all public health messaging in our catchment area and actively promoted vaccine take-up with a positive lens. We were out of time, so we couldn't run a lot of experiments, but we did run one trial, and you'll see the different frames that were resonant with different audience cohorts. The reason we segmented our audience in that way was because that's how the vaccination data was coming through, and we wanted to ensure that we were able to understand how the campaign was performing versus how the real world change was happening or wasn't happening. So this was an integrated campaign. This was the first iteration of 10 plus iterations. It went through, we started with young people, but it went to pregnant mothers and expectant families. We did children and young people. We had loads of different branches from this initial umbrella campaign. We did quite a lot on owned channels as well, and I'm sure Russell can take any questions on that, client side. It was shared. So we did a lot of partnership work. So it was shared extensively in London, which was very helpful. So outcomes, not outputs. So what? Edna asked, and that is the question I ask as well. We smashed our communications KPIs, as you can see here on this slide. But more importantly, in 4 weeks, our campaign contributed to a 77.8% increase in 18 to 29-year-olds accessing the vaccine, and a 10.8% increase for 30 to 39-year-olds. And we also found that all BAME rates increased faster since campaign activation, which was brilliant. And it was great to see our industry recognizing this. And as I said, the campaign served as the start of what would become a brand identity for the ICS. So yeah, I think that's it from me. Keep it short and simple. But hopefully that was helpful.
Thanks, Shayoni. I'm just going to really very quickly just touch on a couple of some resources that people might find helpful. So yeah, very quickly, there is the Government Communications Service evaluation cycle, which Shayoni mentioned. We'll share these slides with you. It's freely available. It's very good. It covers which metrics to use to consider planning, defining your objectives, considering characteristics of your target audience, metrics which assess the impact, and also really key, identifying the learnings. And it is flexible and designed to work with campaigns with a big budget, campaigns with a small budget, campaigns with no budget. So definitely worth a look at. I've gone on mute again. Yeah, again. On this slide, you can see the evaluation cycle and the different phases, with many of which will sound familiar from the previous two presentations. An alternative is the AMEC evaluation framework, and this is really good because it is a template that you can fill in and it generates your report. You wouldn't want to use both of those, but it's just whichever, and actually the GCS one is based on this, but they're both slightly different tools that you know could be useful. And like I said, we'll share these slides, but what would be good now would be if we could have a look and any questions. I've just pasted the links to the different the resources that I mentioned. So just looking at questions, I know you've answered a few in chat already, Edna. Well done. There's one around accessing data, and you know, in your presentation, you obviously got a lot of really good data to be able to measure. Some of us struggle with that. You know, what tips have you got for them, or you know, if people are struggling, how could they get hold of the data in their organisations? Who do they need to ask, and what do they need to say?
Yeah, so it's an interesting one, because I hear this all the time with people struggling to access data, but I don't really understand how, why. So I think in all systems, and ours is no different, we struggle with accessing good, clean data. So even the data that we can access often is quite poor. So some of the coding isn't great, there's lots of blanks, etc., etc. But if you, every organisation in the NHS, so in an ICB, they will need to be able to access this data, because they use it to commission services. They also use it to pay their providers. They need to understand what their activity levels are, what they're delivering, etc. So that data is available. So from I would say in the commissioning department, you can speak to the people that work in planning, commissioning. They must have that data. Most organisations have got some kind of business intelligence or data in team. In local authority, there's so much data. I work with a local authority in particular. In the public health data, there's loads of data available there. Don't necessarily go to the trust, because we don't need to get it. We don't need to go to the trust to get it, because within our organisation, we get that information from the trust. The one thing I would say, if you're lucky enough, and those people out there that are thinking about the makeup of their teams, one of the first things I did when I came into post was bring in an insight and data person, because I know that because I am insight driven and like to look at the outcomes, I need someone who can crunch the data with me all the time, and he's able to speak the language of the people that also crunch data in different departments. So he's the person that often gets the data, and then I tell him what I'm trying to look for. So yeah, so working with insight, your data intelligence, your business intelligence people, they're the ones that have got access to that data.
Thanks, Edna. And I think that data is really key, isn't it? You know, in this example, you know, lots of us have done lots of work around this, particularly around winter pressures, and there are so many different things that affect, so many variables that affect how busy it is at A&E and what's happening across the system. And without that data, because you could do an amazing campaign, but without that data, no one will know, because actually A&E is still going to be busy, you know.
Absolutely. And you know, and if you looked into our system, as I say, our system is so challenged. We're in critical incident all the time in our trust. And actually, if you looked in it on paper, you could look at that and go, well, what was the point in this campaign? Because actually we've still got ambulances queuing outside. We've still got terrible headlines with A&E waits, etc., etc. But actually, when you drill down and you do look at that data, it does show you that actually, if you weren't doing this campaign, things could be a lot worse. This year, what we're trying to look at is the profile of people that are accessing A&E. So we're looking at whether the profile of people have changed based on some of the comms that we're putting out. So things like soft tissue injuries, we know that you don't need to go to A&E, you can go to minor injury unit. So actually, has that the profile of those people that are accessing A&E for things like a UTI again, because we know that pharmacists now can pick those things up. So it's not just about looking at activity, it's also digging a little bit deeper and looking at actually who is accessing and what are they accessing for. But yeah, I'm not going to lie, if you don't have access to that data, it's really difficult. But that's why you should be saying to your senior leaders, if you want us to do if you want us to really support with our strategic objectives and not just be a corporate function of just putting out newsletters, etc., well, then you need to support us in being able to prove our worth, and that means helping us to access that data that can show that what we're doing is actually working.
Yeah, definitely. There's a question about, which I think you've partly answered here, but how did you go about getting initial buy-in from senior leaders for this work in the first place? Were you pushing an open door, or did it take some convincing?
Well, so if I'm totally, so I've been in the system for 3 years. When I first came into the system, because we've got a really massive financial deficit as well. When we came into the system, I was like, okay, where's the money for our winter comms and our winter campaign? And it just didn't come until very, very late on in the year. So maybe December, January. That was the very first year I was in the system. So that was 2021. And actually what we had to do at that point was just piece things together and did a bit of an awareness campaign, but it actually did not touch the sides. So from January, February of that year, I started banging the drum and saying, if you want us to do this properly, if you really want us to help with winter, I need some investment, and I need it early so I can start planning for winter. And I showed them examples of, and Joni kind of showed a really good successful campaign around vaccination. I showed them a campaign that again won awards around vaccination with ethnic minorities, and I showed them what I could do if I had if I could lead with insight, if I could develop a campaign that was very targeted, we could see huge results. And actually that was what it took for them to go, okay, well, here's some money, make sure you evaluate it, make sure you show us what it's delivered. And because it did deliver great stuff, that's why I got the investment in the second year as well.
That's great. Thank you, Edna. And I think so I'm wary of time. I think we've answered most of the questions either in chat or in person. We will have a check through, and if there are any we missed, we will have a look and come back to people in the follow-up comms with answers to those questions. Before we finish, there's a couple of things I'd just like to briefly mention. CAN are arranging and supporting multi-agency strategic comm sessions in most regions to bring public sector and third sector people together with elements of training and development, and also identifying shared interests and opportunities to collaborate. So it's just a call out really. If you're invited to one of these in your area, please go. It should be really useful. And also next Thursday, the 25th at 11 AM, we're going to be running a webinar with a focus on COVID spring boosters and MMR vaccines for children and young adults. So we'll be discussing how you might be able to kind of maximise your comms impact with minimal budgets on those topics. So please watch out for that. But then finally, just a huge thank you to our speakers, Edna and to Shropshire, and also to John Paul for CAN's continued support to this hub. And most of all, a massive thank you to all those of you who joined. It's great to see so many people here. Thank you.